Hey, my name is Mallory Quinn, and I'm going to present my strategic plan for improvement of the emergency department patient satisfaction scores at Baptist Memorial Hospital, Union County Emergency Room. This Baptist facility, a rural hospital in northern Mississippi, Baptist Memorial Hospital, Union County, is known for its great care. We have, in just the past 6 months, had the following recognitions. Leapfrog, a National Patient Safety Watchdog group, gave a grade A rating. We're named one of the top 50 rural hospitals in the United States. We also received a 5-star rating from Centers for Medicaid and Medicare Services. We were the only hospital in Mississippi to do so. And we were designated as a baby-friendly facility by the World Health Organization. In this presentation, you'll discover my plan for further improvement of patient satisfaction scores to reach our goal of 93rd percentile for this fiscal year ending in September. Here you will see a SWOT analysis of the emergency department at BMHUC to determine where our needs are. You'll see the strengths, weaknesses, opportunities, as well as threats. After developing this SWOT analysis, a strategy map for improvement was done. You will see our mission, stakeholders, both internal and external, strategic goal, and the overall strategy map that may explain my vision. All right, and then this is a strategy map that I created. The organizational mission of Baptist is in keeping with the threefold ministry of Christ: healing, preaching, and teaching. Baptist Memorial Healthcare is committed to providing quality healthcare. The stakeholder analysis, as said before, we have internal and external. Our internal are you, our local administration, employees, and our corporate administration. Our external stakeholders are our customers, patients, insurance companies, and competitors. Our strategic goal is to increase emergency department satisfaction by collaborating with other departments of the hospital to decrease wait times and increase patient awareness of status of care. Increasing this patient satisfaction will lead to overall increase in reimbursement, as well as overall patient perception and increased number of patients seen. This will eventually lead to decreasing financial losses. And here is the strategy map. It goes from the top of financial to learning and growth. We'll start at the financial perspective. The goal here is to decrease financial losses by increasing patient satisfaction scores and reimbursement, as well as increased patient volume. The customer perspective goal is to increase the customer experience by decreasing wait times and increasing updates to patients and their families. With the internal perspective goal is to have a stronger standardized processes that will decrease wait times. With the learning and growth perspective, promote collaboration within departments in the hospital to standardize processes within the emergency department to increase number of surveys received, as well as increase patient satisfaction on those surveys. So that is the strategy map. I'm going to go back to the PowerPoint here. Here is the action plan that I plan to proceed with. In this plan, a management by objectives MBO style plan is used due to the highly effective results that it brings. An MBO style plan has defined and monitored goals for every division, project, and individual of an organization. This style of plan leads to more motivation and teamwork, as well as assisting in keeping each entity of a larger corporation aligned in the same goals. For this MBO plan, the goal is set to achieve the goal of increasing patient satisfaction from 89% to 93% in the emergency department of BMHUC. This goal is the same goal set by the corporate office, as well as aligning with the overall mission of Baptist we spoke about before. This specific action plan to achieve this goal and the steps to be taken are as follows in this chart. We start off by establishing the baseline patient satisfaction using the existing available data. We proceed to speaking with the ED staff, as well as other departments who are included in patient care. And then we set one goal to improve the lowest scoring question. We evaluate the progress and continue to review this progress at regular intervals. We start off with the Press Ganey survey results. We're currently at the 89th percentile for our Press Ganey E-Day survey results. We want to reach the 93rd percentile by September of this year to complete our 2019 fiscal year strong. According to the results, our lowest scoring question is, how well do you feel that you were kept informed about delays of your care? My hypothesis is that if we improve on this one question, we'll improve our scores overall to our goal by September. As stated in the action plan, I want to have an interdepartmental collaborative care focused meeting with all departments that are involved in an ED patient's care. In this meeting, we'll discuss ways to improve on our care of ED patients in an effort to raise the Press Ganey survey results. The members of this meeting will be emergency department nurses, emergency department providers. This would include doctors, PAs, and nurse practitioners. We have radiology staff, laboratory staff, and admissions. Specifically for nursing improvements, if we specified a time frame was given to patients who are waiting to be seen or waiting on test results, patients will know more of what to expect rather than just sitting there wondering what's going on. As staff and stakeholders, we all know that coming to the ED, you'll have to wait a bit as certain testing takes time. As a patient, though, this may be the worst day of your life. These patients come into the ED thinking that they're dying and see the ED staff sitting at the desk. They wonder if they have been forgotten about or if anything has even been done to help them. If we focus on giving more specific time frames of Dr. Pitcock will be in to see you within the next 30 minutes rather than the doctor will be in just a bit, for example, they will be more patient and more willing to wait. If we tell them right off the bat that the CT scan of your abdomen is going to take 2 hours from order to results, they won't be in the room wondering what they're waiting on. So as these numbers are shown on the higher side of average, the patient will be pleasantly surprised if Dr. Pitcock is in their room within 15 minutes rather than 30. We're going to type out these number averages and give them all to the nursing staff to place on every workstation on wheels or WOW, so that every nurse will have access to these. We're also going to give a copy of these to the providers so that whenever they're explaining what tests they're going to order, they can give these same numbers so that we all look aligned by using the same verbiage. We're going to continue to monitor and evaluate this set of goals in real time with email return surveys and daily leader rounding. We'll also receive our monthly Press Ganey survey results. I will continue to meet in the interdepartmental meeting team to improve care and make changes as needed. Any questions? Thank you so much for your time and consideration.